Good evening to all. Today's topic encephalitis. What is encephalitis? Encephalitis is an inflammation of the brain, usually caused by the viral infection. Although rare, it is potentially life-threatening. It may be reached permanent brain damage or a death. Encephalitis, acute inflammation, or a parenchyma of brain and spinal cord. Encephalitis with the meningitis is known as the meningoencephalitis. Etiology: infectious encephalitis. The brain is directly infected by a virus which damages the brain tissue such as the herpes simplex virus or a childhood virus such as the mumps, measles, or rubella, bacterial and others. The primary encephalitis, the bacterial infection such as the bacterial meningitis spreading directly to brain. The secondary encephalitis, there may be a complication of the current infection to disease like the sepsis. Certain parasitics, the protozoal infection, such as the toxoplasmosis, the malaria, can also cause the encephalitis in the people with the compressed immune system. Encephalitis, the lethargia, also known as the sleepy sickness or as the sleepy sickness. The disease affects the brain, leaving some victims in a state like the conditions, speechless, and the motions. Sign and the symptoms. Initial symptoms of encephalitis can vary from a mild, a severe cases. Symptoms may include the fever, a headache, the nausea and the vomiting, the fatigue, confusion, seizures, that means the fits, problems with the speech or hearing, memory loss. These all are the signs and symptoms. Long-term complication of the encephalitis as a result of a brain damage may include physical symptoms, the muscle weakness or both sides of the body, reduced sensation, increase the muscle tone, spasticity, or a decrease the muscle tone, flaccidity, poor balance in a sitting and standing, difficulty controlling movement of the arms and the legs for the everyday action, reduce the mobility, decrease the exercise the tolerance, non-physical symptom, the memory loss, the personality change, the epilepsy, the problems with the speech and the language. Diagnosis: encephalitis can be diagnosed using any of the following procedures: magnetic resonance imaging, that is MRI, to detect the inflammation, electroencephalography EEG, to monitor the electrical activity of the brain, lumbar punctures, the spinal tap, the urine analysis, the blood test. Medical management: The treatment of the mild encephalitis usually consists of bed rest, supplanting of the fluids, anti-inflammatory drugs such as acetaminophen, Tylenol, other ibuprofen, Advil, Motrin, IB, others, and the naproxen, the sodium allicin to relieve the headache and the fever. Antiviral drugs. Encephalitis causes by the certain viruses usually requires antiviral treatment. The supportive care. People who are the hospitalized with the subencephalitis might need breathing assistance as well as the careful monitoring of the breathing and the heart function, intravenous fluids to ensure the proper hydration and the levels of the essential minerals. Anti-inflammatory drugs such as the corticosteroid to reduce the swelling and the pressures within the skull. Anticonvulsant medication such as the penicillin, dilatin to step to prevent the seizures. Rehabilitation. The good rehabilitation is a holistic approach. It recognizes to the complex, the congenital, the behavioral, the social, emotional, and the medical problems faced by people affected by the encephalitis and their families. Complications of the encephalitis may require the following services: the physical therapy to improve the strength, the flexibility, balance, the motor coordination, and the mobility. Occupational therapy to develop everyday skill and to use the adaptive product and the help with the everyday activities. The speech therapy to relearn the muscle control and the coordination to produce the speech. Psychotherapy to learn the coping strategy and new behavioral skills to the improve mood disorder and address the personality change. Physiotherapy assessment. Presenting complaint, headache, nausea and the vomiting, fevers, convulsion, confusion, abnormal ambities. History. What is the history? Spreading infection, general weakness, frequency, headache. The vital sign. What is the vital signs? Blood pressures, heart rate, temperature, the respiratory rate. Observation, posture, abnormal posture, gait, abnormal gait, the limb attitude, abnormal attitude, abnormal respiratory pattern, higher function, a level of the consciousness, orientation, confused, memory affected, the speech affected, cranial nerve examination, the sensory examination, the tonal abnormalities, reflexes exerted the positive Babinski sign, range of motion decrease, and the flexibility, strength decrease, Chest and the respiratory examination. Decrease the chest examination and abnormal respiratory pattern. Gastric examination, swelling and the speech difficulties. The cranial nerve examination, the olfactory, the optic, the accumulator, the trochlear, the trigeminal, the abducens, the facial, the auditory, the glossopharyngeal, the vagus, the accessory, the hypoglossal. The cranial nerve examination, the first introduces the olfactory, that is functions the smell, that is optic, the visual activity, the accumulator, the opening of the eyelids, the eye movement, upward, medial, upward, lateral, medial, downward, and lateral. Trochlear, the toning, the eye movement, the downward, the medial. And the trigeminal, the facial sensation, the chewing movement. Abdomin's, the eye movement, the lateral movement. And the facial muscle movement expands the chewing muscles and the eyelid closing. Auditory, the hearing and the balance. Glossopharyngeal, taste on the posture, the third of the tongue, not usually tasted. Vagus, uvula plated muscle, and the swelling. Accessory, the shoulder serve, the hypoglossal, the chong movement. The cranial nerve examination, the 12th the cranial nerve examination that was explained. Third, the bladder and the bowel involvement, the functional disability, investigation, the problem list. The physiotherapy treatment, the aims. What is the aims of the physiotherapy treatment? First, the increasing head and trunk control, the improving sensation and the joint senses, promoting and the facilitating the normal movement in the arms, trunk, and the legs, improve balance, the improving the posture, increasing the muscle strength, improving and the maintain the joint of the movement, relieving pain, enhancing the independence with the functional tasks such as the rolling, sitting, standing, and the walking, improving the quality of the life. Exercises. Exercises to facilitate normal movement, the pattern, and the improve the ability with the functional tasks. Practicing the functional activities such as the rolling, sitting, sit to stand, and the walking. The stretching and the strengthening problem to relieve the stiffness and increase the muscle strength, which will make everyday tasks much easier. Advice regarding the posturing, lying, sitting, and standing. Balance training focusing on sitting and standing balance to help maximize mobility. Advice about the walking aids, the specialized setting if necessary. Manual handling training session for the carriers and the families which will use the therapeutic handling, transfer and the positioning technique to increase the comfort and the promote postural alignment. The therapeutic use of the host and the sling can also be the thought. Thank you.